All right, so the adductors, there are 5 adductors, and they're on the medial thigh. And as the name implies, they all adduct the thigh. They also all medially rotate the thigh. So let's first take a look at kind of the overview before we look at the details. We have, if you look at it from the anterior view or from the front, we have 3 layers. So in the front layer, we have pectineus and adductor longus. So in the front, I'm going to do that in yellow. This pectineus and longus are most superficial or most in the front. And then a little bit deeper to that, the next layer I'm going to do in purple, we have adductor brevis. And then deep to that, we have adductor magnus, which kind of serves as the floor of it. But as you'll notice, when you look at different views, it kind of looks different depending on what part of the thigh you're looking at. And of course, whether you're looking from it medially or anteriorly, but that's from the front, those layers. Now, there's one more that kind of guy didn't really like talk about in that equation, and that is the one that crosses over sartorius all the way up from the AS, crossing across like about so. So we also have sartorius going like that. Here on the right, we're looking at a medial view right now. And I got that same app Paige got, thank you, Paige. And you can, it's pretty handy because the adductors they look different depending on what view you're looking at. I think it's helpful to look at something like this where you can see the different layers. And so we'll try to do it without glare. Here, of course, this long one right in the front is sartorius. And then if we go up from the top, this shorter one, that is not what we're trying to point at. The shorter one up there is the pectineus. Actually, let's cut away a layer because it's hard to see with sartorius. So if we get rid of sartorius, and then we go from the top and left. Hopefully not. Hopefully it does not look delicious. Here we have, this is pectineus, and then we go brevis, and then longus, and then way out to the side, we have gracilis. So it kind of depends, what view you're looking at, how those work out. So, but pectineus from the top, brevis, longus, and then gracilis. So what cut is that? Yeah. So the pectineus there, and then we've got the brevis now in yellow, and then we've got the longus there in green, and then we've got gracilis there in blue. And you may want to make some kind of like mnemonic to remember that, like a phrase that starts with those letters to help you remember what order. Please bring lemon goodies, or you can make your own. And what is that? Oh, there you go. And then we've got sartorius coming from up there, and it crosses over. I don't know why I can't draw right now. So
sartorius is kind of in between the adductor group and the quads.
Yeah, exactly. And since people probably can't hear you too well, the question is, does that place sartorius between the quads and the adductors? Yes, exactly.
Question on the homework. I was like thinking.
Yeah, and you know, the sartorius is not one of the adductors, but it's a super long, skinny muscle, and it's so long and skinny that you can't really usually even palpate it on people. But people who have like really good muscle definition and not a lot of fat, you can definitely like see like a line between and that is the sartorius. Yeah.
Like lean bodybuilders and stuff. And like when I like we'll go and we'll strike certain poses and you'll just see this like the sartorius is just like this thin strip right across the top. You're like,
Yeah. Yeah.
oh,
Yeah, totally. And then here's the view with the origins and insertions. But let's break them down now. So as a group, they all adduct hip and medially rotate the hip. Your licensing exam, right? Those key movements are going to be the ones you want to focus in. And then Trail Guide gives us all the great details. But let's start with Magnus. So starting with origins. It originates on the inferior ramus of the pubis, and the ramus of the ischium, and the ischial tuberosity. So if you remember on the models, a lot of cameras to switch between. Give me a sec. So this should be review, but the rami are the rods that go across. So this is a rami, that's the inferior rami, and this is the superior rami. And all together, the adductors will wrap around this whole area. Now, obviously the genitals are here. This is a vulnerable area. We here stay totally clear of it, and I personally stay totally clear of it. So I don't ever massage the origins of the adductors. There is a way to hold the genitals to the side for men. They would do it, not you, obviously. You can touch these surfaces without touching genitals, but I think it's way too close and vulnerable. And so it's never a part of my practice. You can get to the whole rest of the adductors, the bellies and the insertions, and I think that's plenty of the adductors. But if you have like a sports injury practice or medical practice, you may, for groin pulls, want to do the origins. But I personally think it's too vulnerable for your practice and wouldn't recommend it. And while you're a student of here, don't do it. But on your own, if you want to take that risk, there is a way to do it safely. Yeah.
Would it be within our scope of practice to go ahead? It's great for them for your trying to do this.
Yeah. Yeah, totally. And like, basically, you can have them palpate right from their belly button down until they hit the top of their pubic bone and those pubic tubercles. And once they feel the pubic tubercles, there will be a very obvious tendons coming off of that. And so at that point, they're going to feel gracilis or longus, or sometimes the two are together. And from there, they can work their way around. Yeah, that's a good idea. Mm-hmm. All right, so back to the origin, the inferior ramus, right? We've got down here, this part is the ramus of the pubis and the ischium and the ischial tuberosity. So kind of down around here. And then it inserts on the medial lip of the linea aspera and adductor tubercle. These all kind of wrap around the back, so we can't really see them from this view. If we scoot back up to the previous wonderful drawing, we can see where the magnus attaches right here. But what you can see from these lines, right, their Trail Guide spells them all out very specifically, whether it's the medial lip, the lateral lip, etc. But as you can see from this drawing, all of those lips are very close together on the back of the femur. And as you can imagine, they're all also incredibly deep. So you're not actually touching those, right? It's more of like a point of reference. So you're not literally getting to those particular insertions. All of these are innervated by obturator and sciatic. Just keep that in mind. We don't talk about all the nerves, but some of the major ones. And then, of course, I mentioned already this magnus kind of serves as like the floor of the adductors. And if you flip to your different pages in Trail Guide, you can see some different views of that. Or on the app, you can cut away the layers of muscles too to see that. So, questions about magnus?
So the magnus is most superficial.
No, it's actually the deepest layer. The others are cut away on this view. Yeah.
So does the magnus kind of sit in the like almost in between like your hamstring and the quad?
That's one of the things.
Oh. Yeah, let's see if I still have it handy. I pulled up a cross section for this very process. How to make it bigger. So here's a cross section. This white part is the femur. Let's orient ourselves. Our quads are up here on the front. And then, so we've got our hamstrings back here, where front is the top left, and then our hamstrings down here on the bottom. And here's our adductors in the middle. And you were asking about magnus, yeah?
Yeah.
Here's magnus and right between membranosus, and there's the intermedius.
But it's like kind of in this middle.
Yeah, and they call it the floor. That's what Trail Guy calls it, the floor of the adductors. But this is one particular cross section of the thigh, and it kind of depends where you cut it, kind of where those segments fall. Is that anything else while we're looking at that cross section that you want to talk about or ask? Or all right, let's go back to our adductors. Well, yeah. Let's go back to the medial view. So in the front view, you've got peroneus and longus are the most superficial. So like if the client is face up, those are the top two. But then when you're touching the inside of their thigh, then yes, it's gracilis that's on top. And so you can, I mean, as you can see, and you've already been massaging part of people's adductors, right? Even in Swedish. So you're definitely getting part of the medial thigh. But if you kind of want to get more of it, you can put your client in what some people call a frog position. But basically, if you put their knee on a bolster and you have it kind of out a little bit with their feet out, supine usually, yeah. So one way is to just put their leg out and then you can get part of it. Let me see if I'm picturing that right. Yeah, like that. Yes, thank you. Yeah, you have to be definitely a range of motion drape for that. Yeah, Sheetal was showing it much better than I was describing it. Your hip is laterally rotated and your knee is out. That just positions that you can get to more of the adductors. Yeah. You can also, people will also do this side lying. So you can also have the client side lying and then have their bottom leg straighter and their upper leg more bent. And either way, you can get to more of the inside of the adductors. But we don't need to get like very far up. You know, I would not get any closer than I don't want this to be like a fishing thing. I mean, I would leave a good amount of space. I wouldn't get any closer than like 5 inches to the genitals, and you can get plenty of the bellies from there. Now, a lot of massage therapists would go higher up, but I just think it's too vulnerable. You're just putting yourself at risk. It's not worth the little bit you're going to help your client. You can tell, like James was suggesting, you can tell them what to do. You don't want to put yourself in a vulnerable position is my take on it. You've got a whole career ahead of you. You don't want to he said, she said, whatever said game. Yes? Yeah, totally. Is a very sensitive area too. It also, it should be noted, just because of the way it's innervated, that even if the client has no sexual intentions, it can also be just a sexually charged zone. So, you might be not trying to do anything. They might not trying to be doing anything, but it can still be stimulating to them. So you don't want any part of any of that. All right, so that's Magnus. Sure, they'll be right. All right, and so then here's the rest of them. We already know that they share adduction and medial rotation in common. Let's look at various places they originate. So from the top left here, I'm just going to go from the words on top. Adductor longus starts at the pubic tubercle. So that's going to be really close to this bump right here. Now, we're not going to massage here, but if you are going to direct your client, you can feel right from the top, the bump in the middle. And then adductor brevis, the inferior ramus of the pubis. And here your trail guides got it nicely there. So on the right, our longus up here in red, then our brevis in pink. Then our pectineus in orange, superior ramus of the pubis, top rod or bar across, pectineus. This is another muscle or tendon that you can feel coming out. And then gracilis is our inferior ramus of the pubis right here. And you can see that brevis, longus, and gracilis are all very close together. And again, we're not going to actually massage right there. And from this image, you can also see how close the penis is, right? And so that's why we're not going there. And then our insertions, our longus, we can't see this on this page, but we've got medial lip of linea aspera, brevis is pectineal line, and then we've got pectineus, pectineal line, gracilis, proximal medial shaft is the tibia. Those first three are so deep and you can't really palpate them. They're very, very close together. So I'm not going to split hairs with those three, but I do want to call out the gracilis that is going to share the pes antherinus tendon, and that is a palpable area. So let's take a look at that one, for which I have to stop screen sharing. And while I'm switching over to you, does that bring up questions?
Do you often get people with injuries of that?
People will get strains there. I mean, soccer players, athletes, people definitely get groin pulls. I don't see it a lot in the various massage settings that I've worked in, but I also haven't had like a super sports focused clinic. So, I'll have my runners come in and my bicyclists come in and people training for various sports, but not like a sports clinic. But they would definitely see like groin pulls and.
It's so common. Injuries, then
It does seem more common, you know, the hamstrings do seem more common. The adductors, you know, you're going to irritate them with like crossover motions, you know, which could be like crossover motions in soccer or ice skating. Yeah. How about you, Jill? Do you see this much at the Chiro clinic, or he's got a very sports focus?
He does, but we don't really get a lot of this. And every now and then, but
Yeah. In 30 years, I had one person.
yeah, you go.
Yeah. All right.
Yeah,
So
I'm trying to figure out what is common.
yeah, yeah, totally. So
For students last year.
oh yeah. And he was a big time sports athlete, personal trainer, had a lot of issues from various sports. Yeah. Mhm. All right, so just to take a look at how that gracilis shares the pes anserinatus with semitendinosus and sartorius, and that's the medial aspect of the knee. This is palpable, so I recommend palpating it on yourselves right now. So what you want to do with your knee flexed is to find the tibial tuberosity. So in the front, right below the patella, there's going to be that bump that sticks out, right? And then you're going to go about 1 inch medially to that, and it's probably going to be tender. So feel in there you'll feel it's kind of flat and usually tender, and you may feel tendons in there. Is it tender for you? Yeah.
It's like slightly dipped.
Yes. Yeah. Questions on that? All right. Acupressure point.
Oh,
Yeah. Spleen 9. All right, pardon me. Where did the screen sharing go? All right, so take a look at a couple palpation pictures. So in this image in the top right, you know, you can see with the person supine, how you can get a whole, you know, a lot of the muscle belly of the adductors. And then here's that kind of, some people call it like a frog position, where you kind of put the knee out and you can get, you know, the medial aspect of the adductors. And this is a good picture where you can see right sartorius separating the quads and the adductors. And here's kind of some more isolating kind of palpation moves. And again, we're not going to be massaging that close to the pubic area. This bottom picture, I would never massage that close to the pubic area. But you know, you can isolate the adductors in theory. In this area of adductor magnus, if you feel a big pulse, you could be on the femoral artery and just move off of it. So let's go back just to the actions, because so far we just highlighted the adductions that they all share. But now that we talked about all of them, let's look at the ones that are different. So they all adduct and medially rotate the hip. Then all except gracilis also assist to flex the hip. And then gracilis also flexes the knee and medially rotates the flex knee. And then posterior fibers of adductor magnus extend the hip. So that's your 5 adductors. Any questions?